We were taught in school not to associate with or, don't be friends with your patients. Keep your friends and patients separate. When I got here and looked around, the demographics just dictated otherwise. If I were going to have any friends or any patients, some of them had to be the same people. There weren't enough to go around in the two groups. So I broke the rule and decided to just be friends with my patients. And it's been the most rewarding thing that I have ever done. I'm usually somewhere on the Dalles Mountain 2-3 times a week. Just something about being out there. I can move laterally away from problems that I seem to have run into and I don't see a way around or over. And I'll be walking along and all of a sudden the answer will come. Or say I have a very complicated patient problem that's got 10, 15 different aspects of it that I need to line up. When I'm out hiking for maybe an hour and a half, I can get that organized in my mind and come back ready to do it. I love nature, but I also think it's really interesting to see the fingerprints of people who have lived there. So there's an old power line that was the first power line that went over to Goldendale. I had an 86-year-old lady in the office one day who we were talking, and she had grown up at the foot of Dalles Mountain. Her job when she was 16, she and her sister had each been on horseback dragging those posts up those precipitous hills, and then people would put them up. One thing I like about the Dalles Mountain is you can get up on top and see the entire region and see how everything fits. It gets even more fulfilling when I start to look at, okay, that's where my friend so-and-so lives, and over there is where my other friend / patient so-and-so lives. And I love to know where I fit, and I think that to know where I fit, I have to know where the people I work for are and where they fit. I look back and pinch myself for 3 decisions that I did not know I was making such good decisions at the time. The first was my wife. I have no idea how I got that lucky still, and I've analyzed it a lot. The second was to go into urology. I cannot think of another thing I could have done with my life that I am better suited to or that would have been as rewarding. The third thing is to come to the Dalles. It was not on my radar at all when I came out of residency. I look back every day now and go, this was the luckiest, wise decision I ever made. I'm Gary Gingrich, and I'm a urologist.